Welcome. Come with me. The doctors will see you now.
Welcome back to Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm going to turn this over here, and I'm Dr. Veer Vidala. Sports medicine isn't just about treating elite athletes. It's about helping people of all ages and activity levels and helping them stay active and healthy. In this episode of Fast Talks with Family Docs, we are diving into the evolution of sports medicine within family medicine. Dr. Jim Barrett is a family and sports medicine physician in Oklahoma who honestly needs no introduction. He currently serves as the chair of the Department of Family and Preventative Medicine at OU College of Medicine. He has been the program director of both the OU Family Medicine Residency and the Sports Medicine Fellowship. He's also the team physician for the Oklahoma City Thunder, having previously served as backup physician for the Thunder and the New Orleans Hornets. He has also worked with both the Olympics and Paralympics, including the Paralympics in Beijing and Rio, and served as team physician for Bishop McGuinness High School. His accolades include NBA Physician of the Year in 2020 and the Edith Kenney Gaylord Presidential Professorship and multiple other awards. He is joined by the next generation of sports medicine, Dr. Thomas Owens. Dr. Owens has trained at OU every step of the way, from medical school to family medicine residency, where he served as chief resident his final year, to completing his fellowship training under the tutelage of Dr. Barrett and Dr. Coleman at OU Sports Medicine Fellowship. Now he's giving back as faculty for both the fellowship program and the family medicine residency. Together, we'll explore how sports medicine has evolved, its crucial role as a family medicine specialty, and what the future holds. Whether you're a physician, a medical student, or just curious about the field, this is a conversation you won't want to miss. Looking forward to their insights on Fast Talks with Family Docs. Dr. Barrett, Dr. Owens, thank you for being here.
Thank you, guys.
Thank you for having us. So, Dr. Barrett, we'll start off with you, sir. You were there pretty much in the beginning of the Sports Medicine Fellowship, right? What was your vision when it was all first beginning, and what are some highlights in your career pertaining to that fellowship specifically?
Well, my vision wasn't all that clear when I first started, just to tell you the truth, but there were a couple things that I had noticed. One was in my training, we did not have good musculoskeletal training. And so one of the things that I wanted to try to do was to improve family docs training in musculoskeletal medicine. And part of that I saw when I did my fellowship was that you have a bigger reach when you teach and you teach other people how to teach. And so that was the kind of the instigation of it. I had a great mentor in William Grana, who was an orthopedic surgeon here in town, who was welcomed me into the practice without any hesitation.
Yeah, great guy.
And then I had a great mentor in my fellowship, Jeff Tanji, who's a family doc. He was doing deliveries, taking care of hospital patients, and doing sports medicine. So that was kind of the start.
So, Dr. Owens, then you did your entire training at OU and now have decided to stay and join the faculty. What prompted you to make that decision to remain on as an educator in family medicine and then especially in sports medicine?
Yeah, absolutely. I think it's one of the things that, of course, in primary care in general, I think there's a lot of association with folks that like to not only understand, but seek to share an understanding. And I think at OU, that culture just really runs deep. I had a chance to really have, people that I not only looked up to, but really and genuinely taught me a lot of skill sets and folks that I really learned to idolize in as far as not only the way they kind of work with patients, but the way they also taught and kind of passed down their clinical pearls and what they'd picked up along the way to learners within the program and the community at large. And so getting a chance to, Dr. Coleman was one of our small group leaders in medical school, and having known Dr. Barrett since essentially I've had memory, of course, like you too, Dr. Palmer. And so just to have been surrounded by so many just amazing role models and have this seen again, how gratifying it can be. Not just, of course, a life in medicine you're not going to want for much, but in addition to that, the gratification you get from being a part of the, that process of sharing and getting to bring people under the same umbrella and understanding of, hey, this is how we can work to make you better, and then, hey, this is how you can work to be that person in someone else's life.
Yeah, so I have a follow-up for both of you, actually. So I know your dad's been an educator your whole life. as you guys entered residency, did you enter it with the thought of potentially making medical education a part of your career, or was that something that came to you during the course of your residency or fellowship training?
Yeah, I think that for me, it was always one of those things that I was pretty sure I wanted to do. I kind of, took every step of the way, knowing that it was important to kind of keep my horizons open and learn and soak up everything I could as a sponge going through both medical school and the residency experience. But the fact I kept finding enjoyment, kept finding things that were so fun and interesting, and kept my brain, I felt like, engaged and sharp in it across the whole spectrum of experiences. I knew that was something I probably wanted to keep up. And again, a life in academia gives you a chance to always be learning. And we really should be in this field in general, but even doubly so when you have, medical students and residents and fellows that are working with you, it really keeps you on your game. And I think that's something I always knew I wanted to do. Of course, having my father's background, I had a chance to see it very vividly and up close and personal for quite some time. But I think there was never a doubt in my mind that it's something I wanted to keep as part of it.
All your learners are keeping you on your toes.
And I didn't. I thought, my kind of goal was, in residency, was to be the team doc at KU, at University of Kansas, and do that. And I actually got offered that position during the time I was at OU, and I turned it down. And it was because I realized how much I love teaching and how I wanted to continue doing that. So
That's awesome, sir. I think I spent a lot of time in Wichita, and I've been to Kansas City a lot, so I share that love for KU too. The next question for both of you guys, when you think about sports medicine, people think working for like a high school team or a college NBA team, taking care of athletes, but really there's so much more scope for it. And I think even now there's way practices are incorporating sports medicine doctors. It's always changing too. How do you guys define sports medicine, whether it be in your practice or in like the much larger field of what sports medicine actually is?
I'm going to take the first crack at this, and I'll let you finish up with that. So I define it. I like this definition. Is we like to keep active people active, and then we like to encourage inactive people to be active, and in whatever way we can. And so that's how I define sports medicine. So.
Absolutely. And I'm pretty sure I've heard that definition at least once or twice from Dr. Barrett. So it's going to be a very near paraphrase, if not verbatim. But absolutely agreed. I think one of the biggest things, too, is also just recognizing that everyone's ability to accomplish what they want to do in life can sometimes be hampered, especially when it comes to kind of like the physical and the ability to tackle those tasks. And especially from a musculoskeletal standpoint, that gets in the way of so many people. We know even as primary care that just even being primary care without a fellowship background, you're going to run into massive chunks where having that additional expertise, I think, helps you to get even a little bit further with them and even siphon them off should they need that kind of operative background even more efficiently.
So I'm going to throw in a little something here, just tailing on or tagging on to that very topic. And it echoes back to something you started with, Jim. And one of the things I learned during my fellowship, and Jim, it wasn't because you openly preached it and emphasized it, but just the way you approached medical care it made me realize that a sports medicine fellowship is not something a family doc has to do to deliver great musculoskeletal care. Mm-hmm. It opens up other vistas that might not be readily available. But that is something then that as I've continued as an educator to try and help my residents know, musculoskeletal care is family medicine. And so you do need to engage with people, as you guys have said, to keep the active, to promote the inactive to be more active.
Absolutely.
But that's within the role of family medicine.
It's a third of the problems that we see in family medicine. So it is all over the place. So.
Yeah.
I just have to add that I forgot I'm the only non-sports med fellow here. I'm sorry, sir. That last question should have gone to all of you.
So talk to us a little bit, though, because very few family docs are going to get the opportunity to interact with a professional athlete, whether that's at the highest tier, like with the Oklahoma City Thunder, or whether that's a minor league athlete. But there is a little bit of a different spin when someone's current or future livelihood is dependent on the functioning of their musculoskeletal system. So we want the weekend warrior to recover and continue and get back to their activity. How do you approach it differently when you're dealing with a professional athlete where it ties so strongly into their job?
Well, I'm going to take a little bit of a crack at this. And so first of all, you've got to still treat them. Some of the baseline things have to be the same. Making sure that you do a full history and physical, because it's very tempting to just jump straight to imaging, which we do. So because of their loss of income potential and stuff, we will do much more imaging. We'll be a little bit more aggressive, and they may do more cutting edge type of treatments earlier on in the case. But still, with the weekend warriors, I may still have that in my spectrum of treatment. It's just that it may be a little bit longer down the line that I do some of the other treatments.
Okay.
Absolutely. And I think another thing too is, of course, working with the patient and finding out where they prioritize things. You can imagine where the kind of more competitive athlete, those kind of already achieving those dreams, or people with, intentions of doing so in the future, they obviously want to rush through some of those processes, not only just the workup, but also the recovery options and things. So I think getting an idea of what their priorities are is obviously really important. And then on top of it too, I think, of course, you're going to run into even more maybe on the operative side and then on our side, but the kind of questions of, if someone has this, a tear of the bicep and you're talking about some fraction of weakness, is this something that we're going to, move them along and move them quickly if they're, not necessarily looking at being the next pitcher for the Los Angeles Dodgers, kind of a little bit different picture sometimes. And having that conversation very candidly with them, say, this is what that recovery would look like. This is what the theoretical gains and benefits might be if we did this option versus that. I think it just means for a little bit more delicate conversation. But again, still making sure they understand the full spectrum, regardless of where they're coming from.
And I think there's also, to an extent, a slightly different third-party engagement. If I hurt my back, my wife may ask you when I can carry the trash out again, which is a little different than a coach or a general manager or an owner who wants to know what their asset is like. How do you guys approach that? Is there an engagement or not engagement, a role you take on in communicating with some of those other entities, or do you just communicate with the patient and leave it to the patient to make that communication?
Most of the time in most professional sports, you're communicating with all of the above, and also their agent. And so
I hadn't thought about that, but yeah.
Surprisingly enough, their agent has a lot of sway and directs their care a lot of times. So you're working as a team, and you're working with a larger team than you're used to. Your wife is just as important on those,
right.
But you may be working with their wife too, but also that whole team around them, so that they all understand. And for the most part, every time I've worked with a team, they do have the interest of the player in mind. They want the best for that player.
Right,
so that and we've been fortunate that way. So.
They have entire hour-long seminars talking about just this specific topic, but even especially in the pediatric world, it's even trickier sometimes. Obviously we're dealing with a lot of times parents come in, they want to get their kid's going to be the next Shannon Miller, and they're adamant they're going to be able to make this meet that's in 6 weeks, despite the newfound stress fracture they have and PAR's back. So it's like the conversations that have to be had sometimes too with, hey, I understand what the goals are, I understand what you're hoping for your child. Your child may even be coming to me with this, but the conversation has to be, especially with minors, I think even more delicate.
Right.
Is kind of making sure that they understand this is not just simply getting them back for competition. This is a rest of life thing if we manage this incorrectly.
And then that can even be compounded by sometimes there's the body language you can get from that pediatric patient of, I'm fine with the break. I'm happy to take months off to recover, and kind of helping them balance that with their parents' goals and expectations as well.
True words never said.
Well, hey, we're going to take a break in our conversation. Thank you for being here, listeners and viewers. Thank you for joining us, and tune in next time for the next episode of Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.